Now we're going to talk about the accessory organs. First up is the liver, then we've got the gallbladder, and last but not least we got the pancreas. So here's your liver. When we look at the liver, we divide it into two main regions. We've got the left region and the right region, and this is not going to let me just divide those individually, but this ligament right here, the falciform ligament, that's the landmark. So anything to the left of that is going to be the left, and then anything to the right will be the right lobe. So left and right lobe, but if you'll notice, this divides it up even more so. So we've got what we call a caudate lobe right there on the posterior of the liver. Then we have a left posterolateral segment. Below that we have an anterolateral segment on the left. Then we've got falciform ligament, and we go to the medial segment, medial superior segment, and medial inferior segment. And this medial inferior segment should just be the anterior view there. They're also including a segment that we would normally just have in this view right here, what we would call the quadrate lobe. Next up, we've got the anteromedial segment. Again, we're on the right anterolateral, the right posterolateral, and then we've got the posteral medial. Next up, we'll take a look at these ligaments. As introduced already, we've got the falciform ligament dividing left and right lobes. On the underside, we've got the ligamentum teres, and on the backside, we have the ligamentum venosum. Then around the top portion, we have what we call the coronary ligament, and we have here the triangular ligaments, one on the left and one on the right. Hepatic portal system, so this is the circulatory system's involvement, and we're going to take all of the nutrients that we're gaining from the small and large intestine, from the alimentary canal, and we're going to then send them toward the liver. The liver is going to be the main producer of things within the body. So if you get asked where something is made, 9 out of 10 times you're just going to say liver. So there's our liver right there. You can see they've got it divided into all of those different segments. Here's the hepatic portal vein. So the hepatic portal vein, that is a network of veins coming from the alimentary canal, sending the nutrient-rich blood into the liver. Once we get to the liver, that blood needs to continue on it to the heart, and from there we'll use the hepatic vein. So don't confuse hepatic portal vein with hepatic vein. Hepatic vein is going from the liver to the inferior vena cava. Hepatic portal vein is going from the alimentary canal to the liver. So alimentary canal to the liver, liver to inferior vena cava. We also have the splenic nerve, superior mesenteric, I think I said nerve, superior mesenteric vein, inferior mesenteric vein. So these are all going to be a part of the hepatic portal vein. The superior mesenteric is regionally specific. So this is going to go to the ascending and transverse colon. This is your ascending, this is your transverse colon. So the superior mesenteric vein will take nutrients or nutrient-rich blood from those two segments. The inferior mesenteric is going to take blood from the descending colon and the sigmoid colon, and then it will enter into the hepatic portal vein, where we will enter into the liver. Here's a picture of the pancreas. Bile and pancreatic juice enter into the duodenum, so the duodenum being the very first part of the small intestine. The pancreas has a main pancreatic duct. You'll see that running all the way from the tail, which is on the far right, to the head, which is the far left. Anything in between there we call the body. Now you'll see that pancreatic duct comes down and it forks, it splits, and we go into an accessory duct and a main pancreatic duct. The main pancreatic duct joins up with a tube coming down from the liver. So coming down from the liver we have the common bile duct, and that common bile duct joins up with the main pancreatic duct and enters into the duodenum, or the duodenum, however you want to say it, right there at the major duodenal papilla. Now, if we look at the common bile duct, if we follow that up, we're going to go up to the liver. We have a right and left hepatic duct. you can just barely see those sneaking out underneath the front edge of that liver there. So right and left hepatic duct. Those come down and join together, and their united name is the common hepatic duct. That common hepatic descends and joins up with a duct that we call the cystic duct. So common hepatic duct, cystic duct form common bile duct. Common bile duct joins with the main pancreatic duct. There in the duodenum at the hepatopancreatic ampulla or the major duodenal papilla. Here is your bile ducts. So this is the exact same thing I've talked about, but we're going to see pictures of it. So there is your hepatic duct. You can see the right and left there. If I eliminate that, there we've got right hepatic duct, left hepatic duct, common hepatic duct. So the common right and left, right hepatic, left hepatic form common hepatic, and cystic form common bile. Common bile then goes down into the pancreas and joins up with the main pancreatic duct and enters into the duodenum at the major duodenal papilla. You can now see the accessory pancreatic duct, and that will go and enter into the duodenum at the minor duodenal papilla. So common hepatic, common bile, cystic, gallbladder. So the liver is going to make the bile salts, and if they're needed right away, they just continue on down into the duodenum. So they're going to go right down into the common hepatic duct from the right and left hepatic ducts into the common bile duct, right into the duodenum. If they're not needed, they reverse course and go back up into the cystic duct where they'll be stored in the gallbladder until needed. So if you're the big problem with this in the past has been the low-fat diet, so then lots of gallstones. Basically, if it just sits there, it dehydrates, turns into gallstones, all kinds of bad stuff there. Here's your pancreas. We've got, again, that main pancreatic duct and the accessory pancreatic duct. The main pancreatic duct is dumping into the main duodenal papilla, or the major duodenal papilla, and the accessory pancreatic duct is dumping into the minor duodenal papilla, and again, dumping into that duodenum. Here is the pancreas histology slide. So most of what you're seeing here is acinar cells. These are going to be the endocrine cells, or exocrine cells. So the acinar or exocrine, those are going to be producing the enzymes and all of the products that are going to be going into the GI tract, into the alimentary canal. We have the pancreatic islet cells, and those are going to be our endocrine cells. Those are going to be producing hormones, and they will be secreted directly into the bloodstream. So this is showing the acinar cells with the acinus, again putting that into the duct. That duct will then find its way into the main pancreatic duct or the minor pancreatic duct, finding its way into the duodenum. Those pancreatic enzymes are going to help digestion of proteins, starches, triglycerides, nucleic acids, so they're pretty important. Here we got the blood supply, so we got the proper hepatic artery. So now we're not getting nutrients out, we're getting oxygen too, and we're going to use the proper hepatic artery. These are all, by the way, branches of the celiac trunk. So proper hepatic artery, branch of the celiac trunk. You can see here's the common hepatic, and then the proper hepatic. We've got the cystic artery going out to the gallbladder, the gastroduodenal artery, and the splenic artery. So these are all the blood vessels are going to supply the accessories. So these are going to supply the gallbladder and the pancreas.